All right, so you have lateral knee pain, you've been getting it treated, you've been rolling with that IT band, seems to get a little bit better, but just keeps coming back. That's because if you think of the IT band as the candle, the tensor fascia lata is the lighter to that candle. So if we don't treat that tensor fascia lata, we're never going to have increased stability in our knee. So to treat that, basically we think if we put our hands in our pocket, it's basically that palm area. You're basically going to take the ball, place it right on that area. I want it to bone depth. So you should feel pressure into that bone just above the muscle. So we're in this position. Then we're going to split our legs apart. And then from here, we're going to keep that ball pinned. We don't want it to slide or roll. And we're going to bring our heel towards our butt and then adduct or bring our knees together. And you should have tension on that tensor fascia lata throughout. So you're going to do a couple passes like that. And then we're going to retest your knee. See if you can move around, see if it's feeling a little bit looser, and keep doing that on a daily basis, and you should notice a big difference. And then we add some glute exercises on top of that, and we should notice that that pain dissipates in that lateral knee.